My name's Anne Marie Hughes. We have the great fortune of having Dr. Cukierman, researcher with Fox Chase Cancer Center.
Thank you so much for having me.
I'd like to first ask you, what are you most grateful for and how are you paying it forward?
Really, truly grateful to being able to work under the circumstances that we live today and be able to make a difference and have the opportunity to focus my efforts and my team's efforts in a really important aspect of cancer research.
Tell us a little bit about yourself and what your mantra is in life.
I was born and raised in Mexico City, and after high school, I took a year. And during that year, visiting many countries in Israel, I met my husband from 35 years now. And in Israel is where I did all my training and took my family to the United States to conduct a postdoctoral training in cell biology. After my postdoctoral training, I was able to open my own research in the Fox Chase Cancer Center and start dedicating my research and my team to cancer biology. My mantra would be that it takes a village. More we appreciate what everybody brings to the table, the better off we are in pushing science forward. In this day and age of immense technological advances, we need to get together with the expertise that each person has to push forward a scientific question and just find all of the experts that can help troubleshoot the gaps in science that we have.
Why did you focus your research on pancreatic cancer?
So I guess the answer is twofold. One fold is personal. Like you, I know a lot of people that were very near and dear to my heart that had this terrible disease and that we unfortunately have lost to the disease. I also know a lot of persons like yourself that have been able to survive the disease. And I can understand in a personal way that learning from both experiences will take us farther. And the second tier answer to the question is professional. The biology behind pancreatic cancer is enormously interesting. And this is a very complex cancer. And it really focusing on the cells of the entire organ as opposed to just the cancer cells per se. Pancreatic cancer is the poster child of organ involvement in tumorigenesis.
Wondering if you could speak a little bit more to that and any other unique characteristics that make this a little bit more difficult than the average bear.
Right. To the biology of pancreatic cancer that make this cancer unique. One of those is the lack of symptoms. So very often the patients are diagnosed when the cancer has significantly advanced. And the more advanced diagnosis, the worse the prognostic. Another unique feature of pancreatic cancer is more regarding its biology at the organ and cellular level. So most cancers, all cancers, are systemic diseases. No, it's not a disease of a cell type. It's an entire body disease. But pancreatic cancer involves this systemic effect much more profoundly than other cancers. Not only the pancreas itself completely changes during the process of cancer onset and progression, but the entire systemic effect that the body undergoes during this process is much more profound than compared to other cancers. For example, if the surgeon is to take the tumor mass of a patient during surgery, and we were to open that little piece up and look at it, about 80 or 70 to 80% of the cells are not cancerous cells in that tumor mass. They are actually normal cells that participate in the progression and development of this cancer and are extremely active and completely and profoundly change the architecture and function of the organ. So these occurrences are common in many cancers, but they're profoundly significant in pancreatic cancer.
What is it like to work behind the scenes, and what makes it so rewarding to do so?
When I was going through the stages of my training, I always thought that I will be very, very happy if one day I were to find something that somebody will write a sentence about it in a biology textbook. When working in a cancer institute, I realized that I can do a lot more than just that. And that really we are the pipeline that generates the basic discoveries that others take further and then evolve this into treatments for actual patients, and we can really make a difference.
And such an important job. I wouldn't be here without that.
What makes this really exciting to somebody like myself is that in places that are multidisciplinary, like Fox Chase, I have access to bring my ideas to the clinicians. And we really can have a dialogue where they can convey to me what is it that they need the most in the clinic, so I can better focus my research. But I can also go back and tell them, listen, I think that this problem that you're having comes because of this particular significant biology in the preclinical state to generate a better treatment, and go ahead and test it in actual patients. It really takes a village, but we can do this together.
Personalized medicine is so critical with pancreatic cancer and with a lot of cancers. What are some of the exciting developments that you see?
So we are reaching the understanding that each particular person and each particular cancer, and even some portions of the cancer itself, are unique. And the more we understand about it, the better we can tailor the treatments to the needs of the particular patients. So going back to the same mantra, talking with radiation oncologists and clinical oncologists and surgeons and endoscopists and people that are bioinformaticians and big data analyzers and people that know how to better interpret the thousands of images that we have gathered with the years. Compiling all of this information is where I see the technology going farther, because it is rendering us those little particular things that distinguish one from the other. So working with that type of approach, we can now better tailor and find the combinations, and some of these approaches and some of these ideas are being looking at cancer as a systemic and entire body disease that involves the entire organ, but also the entire person, and trying to combine the drugs and the treatments by targeting the cancer, but also limiting the effect that the normal cells have in promoting the cancer, and providing them with the advantage to actually use the natural defenses against the cancer. So that reciprocity between the body and the cancer, if we can harness it, that will be our best weapon.
Thank you so much. Happy Thanksgiving to you.
Thank you so much, and the same to you.
Thank you.